Perfect. So, yeah, as I said, I'm just really excited to tell you about my journey. And yeah, I hope this will be of inspiration for many of you. So just Rebecca already introduced myself, but really what I wanted like to share with you today is how basically I just started this journey and how actually I fell in love with social entrepreneurship and what were the different triggers for me. As she said, I'm actually like a scientist by training. So, you know, I've been working for a long time in the corporate sector, now at Boehringer Ingelheim in Vienna for the past 3 years. And it was only last year that somehow I bumped into the concept of social entrepreneurship. And this is when I founded Together Women Can, which I will tell you all about. And then how from this experience, I did another step forward and I founded Light Up Impact, which is my own social enterprise. So before I go in that direction, I want to tell you how I got my first inspiration, right? What was the spark for me? And I have to thank Boehringer, I have to say, for this, because when I started to work there, I found out that they had an initiative that it's called Making More Health. And this initiative was founded 10 years ago by Boehringer in collaboration with Ashoka. And the aim of this initiative was to identify and support social entrepreneurs within the organization and inspire basically everyone who has, let's say, the motivation and give them a little bit of skills to become a change maker, because we can all be change makers. And if you think about, if you inspire change makers within organizations, these are the ones that will then shift the mindsets of these organizations and basically just not focus only on the business, but rather work with the social sector to solve problems in the society. And this is what happened to me. I've learned for the first time through this program what social entrepreneurship is about. And I fell basically in love with the problem in the social sector related to my job that I will tell you about. And what I did was I brought this problem close to the organization that I'm working for, trying to show them what is the value for them to invest in solving this problem. And what I also learned is that entrepreneurship is really, it's not a solo mission, just doesn't work. It's really about finding the right team to work with and building partnerships and strong connections so that together you can solve the problem. So what is the problem I fell in love with? I thought, I don't know, it was during the pandemic, you know, and I thought I've been working for like 10 years to come up with new medications for patients that already have a disease, right? For cancer patients. And I reflected on the fact that as a woman living in Austria, I'm extremely lucky that here basically for free every year, I can go to, you know, a doctor and get a cervical cancer screening. And that already itself basically reduces the chances that I will develop this disease in the future. And it's one of the most preventable cancers. You just need the right health tools to access them. And I started to investigate, and I found out that in Kenya, but also in other parts of Africa, since 2018, more than 2,000 women are still dying from this disease. And this number is meant to increase, to double actually by 2025 if we don't do anything about it. And what I was really shocked, it was to see that only 5% of women in the whole of Africa have access to this service. Whereas in Europe and the US, this is like 70%. So for me, this was a huge gap. And I thought we need to do something to accelerate to solve this problem. And actually, you know, deep down, the roots of the problem lie, of course, in complicated topics such as lack of access to education around what cervical cancer is, or sexual health topics, but in general, also around the access to healthcare. So I thought, how am I going to solve this problem right from my office in Austria and elaborate a solution for this on my own all the way to Africa? So this is when I contacted Making More Health. And they directed me towards AMPATH, which is one of the leading healthcare centers in the western part of Africa. And with them, we really investigated the problem in more details, and we built the team. Our African team is made up of Cleophas here, who is the project coordinator, Lydia, who's the program director, and Dr. Omenge, who is the oncologist. And then I thought, you know, I need people from the inside, from Boehringer, because we had no funding for this at this stage. And I thought the only way to get the buy-in from the company is that if I involve as many employees as I can. And this, you see here, Thorsten, Hirbo, Irene, Anna, Elsa, Manfred, they all naturally also got inspired by this whole concept of social entrepreneurship. And of course, they're all also cancer researchers, so they connected to the problem as much as I did. So what did we elaborate all together? This is what we call the cervical cancer prevention journey, because it's not only about providing basically the healthcare solution, but we try to provide education and awareness as well. So it starts with the training the community health volunteers, which are women that are trained on health topics, and they reach the rural areas where there's no access to big hospitals. And the community health volunteers in the rural areas raise awareness about the disease and cervical cancer to women and their families. And they connect them to a healthcare facility that we will equip with the right tools for these women to access the screening. Now the project is for 3,000 women, and we will also cover them with a treatment for 3 months and health insurance, so that if they develop something, at least there's an option for them, so that we help them with that. And now the question comes, how do we finance this project? This was planned to be a 1-year project with 100,000 euros budget. We just started basically from the managers in research, so our direct managers, and we started to tell them about this project and what would be the buy-ins for them. And they gave us some seed funding, which clearly did not cover the whole thing. But we used that seed funding to build our credibility within the organization. So we started to pitch to different stakeholders. And in the end, after 1 year, it took us quite some time, but I have to say I'm really happy of all what the team has achieved, because we have secured this money and we're ready basically to start this in the summer. So just to summarize where this is going, you know, I think what I've showed you is that it's possible, you know, to start something from scratch, to create a team and have some goals, and through trial and error, we basically secured the funding we needed. And in the summer, we will start this 1-year project in the rural parts of Kenya in the western side. So this was really exciting. And we didn't stop there, right? My journey, as I told you, it's in continuous evolution. So through Together Women Can, I got the opportunity to interact with many founders of social enterprises, NGOs, no-profits, who were working in women's health and gender equality in Kenya. And this is what inspired me to found actually Light Up Impact. And what is the problem that Light Up Impact wants to address? So I met Golda through Together Women Can, and Golda is a founder of Golden Girls Foundation. Her mission is to provide menstrual health, which is a big problem in the rural areas, and education to girls in schools about menstrual health. And founders like Golda, right, she creates impact every day, and yet she's lacking visibility and the credibility she needs to secure funding and increase her impact. And like Golda, there are 10,000 other early stage founders only in Kenya that are working on the topic of women's health and gender equality. So this is what Light Up Impact wants to change. We want to provide a networking platform to help all the early stage social organizations that are sharing a focus on women's health and empowerment to increase their visibility and their impact. So what does this mean? We have built a community, which right now is a Facebook group, where basically the founders are sharing, learning, and discussing problems that they have in common together. And we also feed them with knowledge, with opportunities or events within this group. The second step is to find the right partners to build some mentoring chapters on topics that are important for the founders, like measuring impact, sustainability, grants, pitching, crowdfunding, and others. And then the third part is to use my expertise as an entrepreneur in the corporate world to convince other corporates to basically collaborate with these founders. And this is where the founders can showcase their impact with talks, with posters. They can talk about the work they do on the ground and find potential match, a match with a corporate who wants to invest, for example, in their cause. And we will also try to use our expertise to engage the employees in these corporate organizations to exchange their know-how and skills to help these founders grow. And you know, this is of course the behind the network. Again, I reiterate, it's the partnership. This is so important. And as corporates, of course, for now we're trying to work with Boehringer, but the idea is to really extend this to other corporates. Also university, I think it would be super interesting also to engage perhaps the students, you know, in some volunteer work from afar to collaborate with the founders and help them. And then also experienced social enterprises might want to collaborate with us and the founders, again, for exchange of skills and know-how. So this is our current thinking. We have a focus on 4 sustainable development goals, which are good health and well-being, gender equality, quality education, and partnership for the goals. And what we do is in line with these. And this is a next step, of course, but we're thinking already, how are we going to finance all this and what is the business model behind it? And the options could be that we get a membership fee from the organizations that are in our network that will pay for the services. But I think most of the funding we would like to get basically from the corporate partners. In this way, complement this income together perhaps with, you know, the grants and other governmental type of funding. So just to wrap up, to date, we have 71 members in the community. So this was our first, let's say, MVP that was released just a few months ago. What we're working on is to increase the number of partners and the community members. And within the year, we would like to maybe release the mentoring chapters or mentoring program. We're still figuring out exactly how this would work, and organize a first event with the corporates. And we have, let's say, the ambition that if the concept works in Kenya as a start, it could potentially be extended, you know, to a wider network. It doesn't have to stay so local. And of course, the team behind it, because I'm not alone. I have a great colleague, Herboye, who is also the co-founder of Together Women Can. He is like our business consultant in a way. Kevin, he's the founder of a social organization in Kenya, and he has been instrumental. He also worked in women's health for me to build the network there. Chris, she's based in Vienna, and she's helping me with the community manager. And Jennifer, she's based in Kenya, and she's been scouting a bit of the organizations and the customers. And that's it, guys. And really, thank you so much. It's been a pleasure to share my story with you. And please feel free to ask me any question and or write me, an email or a note if you want to discuss further. Thanks a lot.